An estimated 1 in 20 people who suffered from the disease are so-called COVID long haulers. That means they recovered from their initial illness, but often have debilitating symptoms for weeks or even months. Many can't go back to work and face severe financial hurdles. As part of our series Medical Price Roulette, in collaboration with Clear Health Costs, our consumer investigative correspondent Anna Werner looks at some of the challenges they face. Anna? Good morning to you.
Yeah, good morning. The long COVID patients we spoke to say they're sometimes so disabled by symptoms they can't get out of bed. But if they can't go back to work, how do they survive financially?
It is day 154 for me, and I am considered a COVID long hauler.
That was Candace Taylor of Atlanta last August, struggling to speak. Her COVID-19 infection happened in March 2020, but she says she still has breathing issues and other symptoms.
I am pretty much disabled. I can't do small tasks that we take for granted. I can't clean my house without severe chest pain shooting throughout my body.
COVID hit Gayle King of New Jersey over a year ago, too. Now, she says, the fatigue and pain have turned her into a different person.
I don't look like that anymore. I do not look healthy. I don't feel healthy emotionally or physically.
Malena Barcenas is an industrial janitor in Detroit.
I get tired very easily still.
Hi.
Barcenas gave birth to her daughter about 16 months ago while suffering from COVID and in a coma.
The walking is the biggest issue. Going from the door to the car, that could tire me out like for the whole day.
Doctors diagnosed all three women with what's often called long COVID.
We're dealing with a syndrome that we know is quite devastating.
Dr. Avi Nat is studying long COVID patients at the National Institutes of Health, or NIH.
How disabling can this be?
It can be very severe. Many people cannot work any longer, so they've lost their job, and now they are unemployed.
Keeney knows about that.
When dogs have a job to do, they're not bored and barking.
She's lost both her jobs, her personal dog training business and the full-time mortgage processing job that paid the bills. She says she tried to return to that job until the day she says her boss told her she was making too many mistakes.
You've been with me 27 years. You don't make the same mistake, and you certainly don't make them twice. You're not remembering what I tell you to do.
She's been out on disability with her boss's support for almost 10 months, but no one can say how long that's going to last.
Do you have any assurance right now that you are going to be able to go back to work?
No.
Barcenas is on disability too, but says her payments are roughly half her usual salary, and she lost her health insurance in September.
2 weeks after that, I got a bill for physical therapy for almost $3,000. It was like, whew.
And no real idea of how to pay it, right?
Exactly.
They're the kind of stories Connecticut employment law attorney Gary Phelan hears a lot.
I think they're people facing the most enormous challenge of their lives.
Phelan says many of his clients with long COVID can't work, but have trouble even getting disability payments from the insurance plans provided by their employers. Candace Taylor, for example.
It has been a tug of war with the insurance company.
She worked at a hospital that provides disability insurance, but even though her doctor diagnosed her with post-COVID syndrome, the insurance company fought her claim. In March, they sent this letter denying short-term benefits, even claiming in part, falsely, Taylor says, that she had a psychosomatic illness. In other words, one all in her mind.
I never thought I would have to suffer for benefits that I worked for.
Are a lot of insurance companies turning down people's disability claims?
I think generally that has been the case. A lot of them are based on, symptoms that it's hard to define. They change over time, unlike the nature of other medical conditions. And so because of that uncertainty, it gives really insurance companies more of an ability to deny claims.
At the time of our interview, Taylor said she was 3 months behind on her rent and had gotten 2 eviction notices.
There's days where I'm sad. There's days where I want to give up, but I know I can't give up. There's a small part of me that just has to keep fighting.
Gayle King tries to keep her spirits up too, but says what really hurts most is losing the dog training business she loved, that she hoped would eventually become her full-time livelihood.
And I don't know if I'm going to be able to reopen my business. Yeah, breaks my heart. Really does.
Well, Taylor fought her insurance company, New York Life, for nearly a year. The company wouldn't discuss her case with us, citing privacy and confidentiality concerns. But just 2 days after we contacted them, she was approved for both short and long-term disability.
Well, that's good news. I mean, I can imagine the slap in the face when you're paying a company to protect you, and then they say, oh, your illness is all in your head. That's quite the insult. What is the main stumbling block for these people trying to pursue their disability claims?
Well, I think part of the problem is this syndrome is so new. Everybody's still learning about it. And so employers, and probably to some degree the insurance companies, are still catching up with this. The other part, as the attorney pointed out, is the symptoms can change from day to day. You know, there's so many, it's a variety of symptoms. And so an insurance company might say, well, you know what, we just don't see where the consistent diagnosis is here, so we're not going to approve your claim.
Are legislators willing to step in here?
Yeah, so the NIH, Congress gave the NIH more than $1 billion for research and possible treatments. And the NIH and CDC doctors also say another key here is educating doctors, treating physicians to how this plays out. What are the symptoms? What do you look for?
Yeah.
It's so scary because there's so much that's unknown. I mean, you think you get it and you survive, and yet you still have these problems. I really do hope that they all just hang on. I felt from Miss Taylor in particular.
I really did. And you think if you have a letter from your doctor, then you're going to be okay with your insurance company, but clearly that's not always the case.
No, and you have to, a lot of times, one of the pieces of advice here is if you're suffering through this, try to get yourself a lawyer if you can, somebody who deals with employment law, because this stuff is tricky.
Yeah.
That's not what you want to hear when you're feeling like that.
No.
You need to get a lawyer. All right, Anna, thank you very much.